Hi, everyone. My name is Becky Brasfield, and I just wanted to say good morning, good afternoon, and welcome. I'm going to go ahead and share my screen with you, and we're going to go ahead and get started. Okay. So, welcome everybody to the 2024 Supervision of Peer Workforce Conference hosted by Share. I am really excited to be with you here today. Again, my name is Becky Brasfield. I'm going to be presenting this presentation to you. It's called Peer Specialist Employment Rubric for Compensation and Benefits, Working Towards a Career Ladder. So we're going to rock and roll, hip hop, peer support, don't stop. You know, I'm very excited about this topic. So I hope you are too. For some people, you come to this excited about the idea of a career ladder for peer support. Some people are just interested. What is a peer specialist employment rubric? What is she talking about? And some people hear compensation and benefits. And we've been talking about this for many years in the field. So some people are new to this concept. Some people have been talking about it for a long time, and I'm here for everybody for us to have this conversation today. So I just want to say thank you to Lizzie Hartigan for inviting me, and Billy, our host. And just to give an image description for anyone who needs it, I am a Black woman with brown hair wearing a black, white, and gold shirt. As Billy told you, I am a certified peer specialist, and I work as a policy researcher for Human Services Research Institute. And I am a peer specialist in Chicago. So I am based in Chicago, Illinois. My contact information is below, but I will have it at the end of this presentation. So let's jump in. So this is just a little bit about me, but I want to learn a little bit about you all. So if you can put in the chat, if you don't mind, some of you have already done it. I see somebody's here from Baltic Street. Is that New York? Hello, hello. You want to put your name if you're affiliated with an organization and your location in the chat, so we can just get to know who is here, who is on board for the next step of climbing up that peer support supervision career ladder and supervising peers to reach our goals. If you want to put your name, affiliation, and location in the chat. So again, this is just a little bit about me. I'm not going to spend too much time on this. It's just I've been in the field for over 10 years, about 14 years. I studied psychology and sociology at the University of Illinois in Urbana-Champaign. And my experience in the field, I've worked at residential settings, community mental health centers, you know, for-profit, corporate, and non-for-profit. So I've seen all the different things that go on. And I was former president of the NAMI Illinois Alliance of Peer Professionals, which is, we have a professional peer association in Illinois. And that was a great joy. I finished my term just earlier this year. So that was great. But another part of what I do is a policy researcher. So I was hired full-time in January with Human Services Research Institute after being a behavioral health policy fellow. And I also had a fellowship with the Cook County Racial and Equity Cohort Fellows, which is funded by the MacArthur Foundation. And thank you for putting all your information in the chat, and welcome to everybody. Part of my interest is in justice reform because I am a peer specialist who was formerly incarcerated, because when I had a psychiatric break, I ended up in jail, incarcerated. And so I understand that recovery from that system impact is real, and I advocate for people so they don't have to go through it too. Okay, so what we're going to talk about today. What we're going to talk about is this peer specialist employment rubric I want to talk to you about. So we did our welcome and introductions. Thank you, everybody. And then we're going to talk about the national standards for peer certification. We're going to familiarize everybody with them to make sure we're all on the same page about what the national standards are, because we need to create a basis for even discussing a peer rubric for creating a career ladder. We talk about it, but we got to get these pieces together. So then I'm going to talk about the framework for creating the rubric. We're going to go over the 7 criteria together with an activity. We'll have a little debriefing discussion to work through this. And then there'll be time for question and answer if you all have thoughts, feedback, and things you want to discuss, issues that you may have brought to the table to this presentation today. Okay. Okay, so here we go. So what are the national model standards for peer support certification? Some of you may be familiar with these already. Some of you may not, okay? But let me tell you, those of you who are not familiar with them, what this is all about. So in the fall of 2022, SAMHSA's Office of Recovery, big deal that we have this Office of Recovery now, okay, was tasked with the development of the national model standards. And so the Office of Recovery partnered with federal, state, tribal, territorial, and local experts, including peer specialists, to create these 11 standards that you see on the screen. Now, some of you may actually have participated in creating these standards. Some of the people in this Zoom room, through the comment portion and process, depending on where you're from and if the word got out to you and you had the opportunity to post your public feedback. So they published the National Model Standards for Peer Certification, and this is what they are. So again, the reason why I'm going to familiarize us all before we get into the rubric with these National Model Standards for Peer Support Certification is so we're all on the same page and framing the discussion of the rubric and expanding our career ladder and possibility. So I'm going to go through them. It's going to be a little interactive in chat. So let's help us have this discussion and get through this. So number one is authenticity and lived experience. So all this means is that a person has an authentic lived experience of lived experience of a mental health or substance use and can be able to describe the strategies used to address those associated challenges. I will tell you all, in Illinois, there are some issues coming up of authenticity. Some people are applying to peer support internship programs simply because they pay stipends of $500 a month at the university. They are not doing it because they have an authentic experience. So this is an important standard. Number two, training. Training requirements, according to SAMHSA, should range from 40 to 60 hours for mental health, substance use, and family peer certifications. In Illinois, depending on the program, it can be up to 100 hours is the training requirement. So that means like CEUs and all that stuff, they'll take certificate of attendance, I think, even if it's not a CEU. But the situation is this. In one state, it might be this. In one state, it might be that. But the national standard they're recommending is 40 to 60. So I'm just going to ask now, for the people that are in this room, if you know your state standards, can you put how many hours it is in the chat? Illinois is 100 if you do it without the training program, and I'm not sure, I have to check the updated with it's not. Can you put it in the chat if you know it for your state, how many training hours you have to become a peer specialist? Okay, and I'll let people put that in the chat. Okay. Let me check the chat. 40 hours, 40, 80. Okay, so it's different around. Okay. Thank you for sharing that because that's learning for us. Okay. Next. So that's about right. 40 to 60, we see an 80, and the 100 is kind of high. Now, examination. What do you all think about this? Okay. They're saying for national standards, we need to have an exam. I guess to be on par with other professions, we need the examination. But I can tell you in Illinois, many people fail the exam. I don't know, but this is something our peer support organization was going to look into. This was on our agenda. Who is developing this exam? Because they recommend at SAMHSA that peers are a part of the process. Number 4, formal education. This is also something that was controversial when it came out last year. What SAMHSA says is, In lieu of any formal education requirements, prospective certified peer workers should be able to demonstrate literacy and fluency in the language which they will be providing services. So, in most states, this formal education requirement is what? High school diploma or GED. So that's part of having that standard that has to do with the pay rate, the entry level pay for peer support specialists. If it becomes literacy, does that change how we can argue for the pay standard for our peer support specialists? I don't know, but we have to really think about that. But that is the recommended standard. Okay, 5, supervised work experience. They recommend a maximum of 120 hours. In Illinois, it's 100. And you can do it volunteer, or even if you're incarcerated. And I did my hours while I was a volunteer unpaid. 6, background check. What do you think about this? So they say background checks should be the responsibility of the hiring organization rather than part of the certification process. I want to ask you all, what do you think? Do you think that background checks should be the job of the organization, the certification, or both? Can I get some responses in the chat? The organization, the certification, or both? Samson says it should be the organization that hires you. I don't know what it is in how they do it in different states. Let me check the chat. I see most people are saying organization. Organization. Okay. Yeah, because the organization, that's going to depend on the need, depending on who you're working with, the population you're working with. So that would make sense. So that's that situation. But I will tell you, there is a national peer certification that goes through the Florida, it used to go through the Florida Certification Board in Mental Health America. I think it's NPRS. They do a background check, and that has been discussed at National Association of Peer Supporters. 7, recovery. Now, recovery pathway means that there are specific recovery pathway specific requirements, including those that are abstinence-based, should be excluded from certification requirements. What does that mean? What that means is there should not be something in the certification requirement for a peer support specialist that says you have to have a certain abstinence from something, that shouldn't be a part of it. It says state certification entities should allow hiring organizations to consider pathway-specific recommendations that meet the needs of the population they serve. So some jobs, I have heard this. I have not been in that experience, but I have heard it on other calls. People talking about, I was told at a job that I had to have 2 years of sobriety. Okay. They're saying that should not be a thing for peer support certification. Some people will argue they shouldn't even say that for a job. You're really not allowed to get into a person's, that's kind of like almost a medical, situation there. But people are asking that on the job. So that's something, if you're an advocate, you have to think about. 8, diversity, equity, inclusion, and accessibility. There's not much to say about this. Our profession as peers was based on inclusion and accessibility and diversity and equity. So that goes without saying. Ethics. Okay, SAMHSA says that we as peers should be required to read, sign, and adhere to a peer worker code of ethics. Most of us, do that. Supervisors do that. And then it says we also should receive continuing education on ethics annually. Cost and fees. Cost and fees, it says state entities should work with states to find resources to subsidize the cost. Let me ask you all a question. Who pays, if you're a peer support specialist who paid for your state certification? I'll tell you for me, because the state initially covered a cost for me. I've had an employer cover my renewal, and I've had to pay for my renewal. So I've had employer, state, and self pay. But I want to ask people in the chat, who's had to pay for your state certification? Was it yourself? Can you put that? Your employer or the state? Who paid for the state certification? Because they're saying that the state should have to pay. Oh, I see county too, city, state, New York City. Myself, grants were also available depending. Share pays. Oh, this is really good stuff. Okay, this is really interesting. So, so we are getting some support there. And then finally, peer supervision. And so they ultimately say that scholarships should be available if you need to pay for certification though, and I saw that in the chat. So that's good. And finally, peer supervision. Now that's why we're here today to wrap up. So they say, okay, this is what SAMHSA says. Okay, there's different viewpoints on this. Because I've had supervisors that were not peers, and I've had supervisors that are peers. Okay, they say state certification entities require that prospective certified peer supervisors have direct experience as a peer worker. So if you are a certified peer supervisor, you should have direct experience as a peer worker and relevant lived experience. And they also say you should be trained in the following on this list. Number 2, the training. Number 4, you should have the formal education. Number 8, the diversity, equity, inclusion, accessibility. And number 9, ethics. Okay, so that takes us through the national model standards so we're all on the same page. Now, let's get to the rationale. Why are we talking about peer specialist employment rubric? Okay, most of us know this because I see from the chat, this is an experienced group. A peer specialist definition, okay? A peer specialist is a mental health and or substance use peer service provider. For the sake of this conversation, a peer could be shared experience in another form. A person with living experience, okay, of the condition. They have specialized training in peer wellness and recovery support. Now, what is a rubric? I'll share with you the definition. Those of you who have a background in education, research, or maybe advanced in the field are familiar with rubric. It's a set of criteria for assessing work or performance. It provides details and specifics. It can be grid structure, and the scoring can be numerical, 0 to 5, 0 to 10, 0 to 100, or analytical, average, excellent, all that kind of stuff. Now, why are we doing a peer specialist rubric? Primarily to create a peer specialist career ladder. Put some more rungs on the ladder, meaning progression from entry-level positions to higher level positions, titles, pay, skills, responsibility, and authority. Some of us are very experienced in the field and want to expand and are finding a ceiling. Another reason for the rubric is to promote fair compensation for qualified peer specialists. Okay, so we are expanding the job title. When I first started, there weren't very many directors. Then I became a director. That had to be a created job. Now it's more common, but not common enough. So we want to expand and create some more titles and levels so experienced people can get compensated. And finally, because 66% of peer specialists work in jobs requiring certification. But that's not all. We know there's a diversity of range of skills. range of qualifications and aspirations and goals for peer specialists as supervisors of peers to consider. Some peers may want to work in the sports industry. We haven't even tapped into that. How are we going to do that? We have to find a way. And so now we're going to start. I'm not going to get too much into this slide. This is just here to tell you that the peer specialist rubric was not developed on a whim, okay? It came from over 10 years of reflections and experience, having positions in the peer world from entry level to director. It's practice-based, it's not scientific-based. It needs to be studied. We'll talk about that in the limitations. From being a supervisor of peers, myself, having hired peers, having done compensation review of peers, having done hundreds, if not thousands of hours in specific peer support education. I've done evaluations of ethics and policy violations of peers that have either gotten promoted or have gotten terminated, okay? Whole team lead evaluations and service on many boards. So now what I'm going to ask you to do is participate in an activity. And after the activity, we're going to debrief and have a conversation if you are interested in doing so about this. Now, this is not the totality of the peer rubric, but I'm going to give you a snapshot so you have a feel for how this goes. It may be uncomfortable, it may be odd, but we're going to try it together and see how it goes. Okay, so we're going to do an activity. I'm going to ask you if you have a piece of scrap paper or you have an open Word doc file that you can type on or something, you're going to need to just jot down a couple numbers and maybe notes, but mostly just the numbers and maybe a note, okay, so you can participate. And what I'm going to do is take you through the 7 basic criteria of the peer support employment rubric, okay? And what we're going to do is that you're going to take on the role of the supervisor. You're the peer supervisor who is evaluating a peer staff member, peer specialist staff member who you supervise. Now, I'm going to ask you to select a person, not necessarily a person you actually supervise, because we want this to be confidential and anonymous. I want you really to pick somebody you don't supervise. Pick somebody that you know from, previous supervision, or you know from another job, or you've seen somewhere doing, groups or something, training, okay? But we're going to pick somebody based on the criteria I give you. And then you're going to do the evaluation and see how it feels, okay? So, group 1. You are born, all the people on this call born between January and July, you are in group 1. I want you to think of an experienced peer specialist. One experienced peer specialist I want you to think of. I don't want to know their name. We don't know what nobody wants to know. It's anonymous. Just think of one experienced peer specialist. Group 2, all the people born August to December. You're going to think of a less experienced peer specialist, maybe somebody in training, maybe somebody with 3 or less years of experience. Okay, not a client, not a person getting services necessarily. They could be also getting services, but we wanted to talk about a peer specialist, someone in training or working as a peer specialist. If you cannot think of somebody in that category, pick any peer specialist you know, okay? I'm going to take you through the criteria. You're going to assess the person, not based on their job, but based on the criteria. And don't worry about how the numbers fall. I just want you to go through it and see how it works. And I'm going to tell you one thing about this, okay? The peer specialist employment rubric is intended to be used in its entirety to assess the diverse range of skills of the individual peer specialist, regardless of the job description. However, if conducting the assessment in its entirety on a 100-point scale may give you a sense of the peer specialist skill level in a broad scope. However, if certain rubric are not applicable to their specific employment situation, you could choose to omit the section. But I want you to not think about their job. Just think about the peer specialist, okay? Now we're ready to get started. Okay, so this is just, this is not the whole thing. I'm just giving you a little taste of it so you can see how it works. Okay, criteria 1 is lived experience to lived expertise. Criteria 1 is out of 20 points. I want you to rate the person's job performance and lived experience to lived expertise out of 20 points, meaning they have learned experiences and lived expertise, their recovery from health conditions, knowledge gained from navigating social, governmental, and human service systems, their practice of wellness and recovery, their street smarts, overcoming challenges, hardships, crisis, self-care, managing stress, demonstrating growth, having a positive attitude, conveying hope and optimism, overcoming prejudice, discrimination, and bias, being flexible and emotionally intelligent, and demonstrating resiliency. Please assign your peer specialist a total out of 20 points. Criteria 2 is subject matter knowledge and skills. Subject matter knowledge and skills is out of 15 points. Subject matter and skills is knowledge of treatment modalities, skills related to peer and recovery support, self-disclosure, outreach, documentation, care management, rapport building, problem solving, individual group support, like doing groups and things, individual one-on-ones, advocacy, ethics, wellness, mentoring, and their knowledge of technology. Please assign your peer specialist a number out of 15 points for their subject matter knowledge and skills. And be mindful of how it feels to do this. This is your supervision, okay? Criteria 3 is advocacy. Advocacy is out of 15 points. Advocacy includes public speaking and storytelling, attending meetings, rallies, press conferences, organizing, community organizing, even protests. Advocacy can include legislative outreach, lobbying, drafting policy reports, witness slips, public testimony, letter writing, petitions, social media announcements, making calls, emailing outreach, fundraising, trainings, and media. They don't have to have all of these characteristics. I should have said this, I'm sorry, to get a perfect score. It's just based on your assessment. Please assign your peer specialist a total out of 15 points for advocacy. Criteria 4 is leadership. Leadership is 15 points. Leadership is practiced through service and action, through mentoring, just being a facilitator, being inspirational, leadership by example, being visionary and independent thinker, executive leadership, peer, community, family, organizational leadership, being a trainer, a presenter, supervisor, manager, director, team lead, local, state, federal, global leadership, consultant, subject matter expert, councils, commissions, work group appointments, and board of directors. Please assign your peer specialist a total for leadership out of 15 points. This should say 5. Okay. Criteria 5 is credentials. Credentials is 15 points. Credentials include being a peer support certifications, recovery support certifications, family support certifications, additional licensures and certifications in wellness, recovery, and mental health. Maybe they're CPR trained or something like that. Additional things, substance use and related specializations if they're in training or have advanced training. Credentials. Please assign your peer specialist a total out of 15 in credentials. Criteria 6, we're almost done, is research and project management. Research and project management is out of 10 points. It includes formal or informal research, analysis, reports, data collection, interviews, literature reviews, presentations, coordinating, project management, implementation, evaluation, assessment. It also includes writing, reviewing, publishing articles, editorial work, creating or using internet resources, developing and using materials for programming, grants and fellowships, being on listservs or conducting listservs, committees, referrals, and conferences. Please assign your peer specialist a total out of 10 for research and project management. And finally, criteria 7 is formal education. Formal education is out of 10 points. Formal education could be a GED, high school diploma, associate degree, college coursework, graduate degree, professional school, doctoral degree, academic honors, education associated recognition. It could be the school rank, continuing education, specializations or focus, doing a capstone, a thesis, or a dissertation, being self-paced, doing co or extracurricular activities could be formal education. Please assign your peer specialist a total for formal education. Okay, now we're going to do the debriefing. So now, that might have been very uncomfortable, comfortable, strange, weird. It's new. So it's not tested. And we're going to talk about that. But this is what the expected ranges are from consultation with peers. That the entry level peers would be anywhere from, it's really 0 to 40. So I want people who picked, and then the mid-career would be 40 to 60, and experienced supervisors would be 60 to 100. So I want everybody that was in group 1, which was the experienced group, to put the number that they had for the experienced group. Those of you who had experience, can you put that in the chat? Did it fall in that range? And actually, I'll stop to share so we can talk. Okay, can I get pinned? Okay, am I on the screen? Billy? Okay, you all, so I want to get some feedback about how that felt. So let's talk about that. What was that experience like? Okay, I'm looking at the chat. Okay, I see 50, 90, 55, 45, 43, 61. Okay, I need to go back. Does anybody from the group want to share about that? Okay, then I'll go and ask the next group.
So can I ask a question really quick?
Yeah, Sean.
Thank you. So when we add up the total number, what was the experience? What was the last category on your form for you know, the director and manager? Was it 60 and above? I can't remember.
Okay, Sean.
Yeah, there we go. 60.
So this is what the expected ranges were. This is not evidence-based.
Okay.
So this could be totally wrong. We're looking to pilot it to find out and get feedback about what people think the range should be. So it looks like the numbers are a little off, or a little high. It looks like the numbers are a little high. Like this is a little...
I agree.
Too much. This is a little too much. Like it should be more in here, or the instructions should be changed. Can people give me feedback about what it was like for the experienced group to actually, you can put it in the chat or speak up. what it was like to actually do this. Did it feel very awkward, or like nobody gets a perfect score? You can't do this. This is too much.
I think for Becky, this is Megan Baumgartner. I think for me, just kind of the person that I was kind of thinking about may not have had the opportunities to have some of the training and some of the things that you have in the rubric criteria. And I think that could have been some of the thoughts behind what I was thinking. So like the individual I was thinking about has had at least 5 years of experience working as a peer, but the peer has also had worked in different areas of the peer realm. Like where I work, I don't know if you've ever heard of a WISE team.
Yes, I have.
But we work on a WISE team, and this is the first time that this peer has worked in a WISE team, and this person is new to WISE. So some of the things that the person has had may not have had the opportunities to have some of the opportunity to meet some of the criteria. Like, what am I thinking?
Really important to know that peers. Thank you, Megan. That is really important to know that peer specialists are not getting the opportunities to do these things that could expand their skill level and their resume to be valuable in the sense to ask for the elevated career status. So it's the opportunity that I'm going to note. Thank you. That is really powerful. And I see a hand is raised. Billy, can you help me see who has their hand raised?
That would be Sean Brennan.
Okay, Sean, you have the floor.
Thank you. So I was actually thinking a little bit on the same lines as what the last member said. Megan, in regards to the fact that the other thing peers are not taught in any of their trainings is strategic planning for their career.
Yes.
And so a lot, when I started my career, I knew that I wanted to start my own peer run program. So I had a very specific criteria for what I wanted to learn from when I chose to work for a medical model program, when I chose to work for a peer-based program. There were certain things that I wanted to learn, like how does a good board of directors run? All these different things that I had set for my own criteria. And peers, unfortunately, peers that I work with on a daily basis who are just starting their careers, because I also facilitate workshops for one of our peer programs here in New York City. They are not taught strategic planning. What do you want for your career? What are some basic questions you should ask yourself before you start on that career journey, before you even get out of school? What did you learn in school that you were fascinated by? Did you really love housing? Did you really love some other aspect of our industry and our field? So I feel like strategic planning is something that we should also be considering.
Okay.
So that we can meet this.
I think actually, Sean, you nailed it. That this is not even so much a rubric for assessing, it's a strategy for climbing and actually doing a career planning path that we don't have. You're absolutely right. Because when I started in the field, there was no planning. It's just you get a job as a peer specialist. That's it. That's all. Okay, this is brilliant. Now, let me ask those of you in group 2 who had the less experienced peer specialists. What numbers can you put in the chat that you had, if you don't mind sharing? Did they end up in that entry level 15 to 40, or were they not there? Let's see what we have. Okay, we have one that was 35, 45, a little bit higher. Okay, thank you, Jana and Jenna, and Maddie. Okay, so we're having them in that range. Okay, so it sounds like the range is a little, for the experience is a little off. That has to be worked out, but that can be done with piloting. But even more so with Sean's thought, it's more about strategic planning. Okay, and I'll skip through this for the sake of time. So the challenge is, it just has to be piloted, because it's like you all are helping. When I talked to Libby, she said, you know, this is something that's in the works. This is something that needs, you know, feedback. So we're going to be looking for people that are interested in piloting something, and agencies to get this going. But, you know, maybe there's another method. And I'm happy to credit those of you who participate, like Sean, for that idea. Happy to credit you, because I think that career planning is a really good idea to use. And I believe in crediting people where they're deserved. So Sean, if you would like to connect later, let me know. And then not everybody agrees on work qualifications and responsibilities of greatest importance. So those things that are in the rubric, you know, some people don't think they're even important. So, you know, why even do it? But I think some of those things are important, because some peers say this is what counts to them. So better to put it in. And it can be complicated when used with your job description. It's really a global scale, but those numbers are misleading. I think that scale is misleading. So it really needs to have a scientific base. And then also, peer specialists may feel undercompensated with few options, those that are very experienced in the field from something like this. The entry-level peer, that pay and benefits probably not going to change. It's the peer specialist that starts moving up and is a supervisor, they're going to be affected. That's where the ceiling is. Okay, so this date is probably going to change. The copyright is already done for the peer specialist employment rubric, but it's under revision. So it's probably going to change. May 1st, it's probably not going to come out, because we want to do a pilot, and I'm talking to people about doing the pilot. So if you're interested, let me know, but that's something that we'll see what happens with that. So we're trying to expand this career ladder, because like I said, some people want to work in different fields. They want different titles, and they're very innovative and have different ideas. Well, we have to make a case that peer specialists can work and do different jobs and get different pay. We have to have a basis for it. If we're going to do it, then we can do it. That's how we created it. And so that's what we're working on. And then also just a word, this book, I did publish it 2 years ago, 365 Wellness and Recovery. It's 1 year of group facilitation ideas. So I did want to put this in here just because if you do supervise peers and they do a lot of groups, it's very helpful. It has 365 ideas for doing groups with activities and lesson plans for wellness and recovery groups, one for every day of the year. So that is available, shameless plug. And then we're going to wrap up here and close with, I want to thank you all for being attentive at this group, and you know, and for coming to this peer specialist employment rubric, because today we talked about the national standards, some of the stuff that's going on with those national standards. We talked about you know, the strategy for how to expand our career ladder. I didn't so much talk about the challenges of being a peer specialist supervisor. That's not exactly what this was about, but I do believe, and I've advocated in getting peer specialists higher wages, and I've been successful in doing it, but I'm trying to expand the peer specialists, those that I feel are very qualified to go and move into different professions. And I know things like psychiatrists, medical doctors, they have established a certain level of pay grade because they go through schooling, they go through this, Well, there are peer specialists that are very effective in helping people recover. And if we can establish this, I think there is a way to help people, help our profession grow if people could really see how much we help. So with that, I want to close and open the floor for comments, questions, thoughts, feelings, and reactions. Feel free to put in the chat, or we can have a discussion of that. And I'm going to stop share, and so I can see everybody. Okay. Hi, Mark. I can see you. I can see Megan. I can't see everybody.
One thing I like in that assessment is that it was so I know staff, like I don't directly supervise, so like I don't know a lot of what's going on with her, but I do know she has her lived experience, and at times her lived experience kind of comes back up to the forefront to then like she has to like call out of work and things like that. And so like I know like the lived experience like makes her qualified for the job, and at times it kind of like comes back around where she has to take time off to address things with her children and her grandchildren and things like that.
Yeah, Megan, it was hard for me to hear you, but you said you supervise somebody, and there's some challenges with that because she's taking time off frequently.
Yeah. Because she has her lived experience.
Yes.
And sometimes it kind of comes back up with like her children go into crisis, things like that.
Exactly. And you know what? I'm glad that you brought that up, Megan, because that's one of the components that we discussed about lived experience to lived expertise. Okay. How well a peer specialist is managing their living experiences, because now, you know, people are talking about their living experience, not just their lived experiences, and their work. I have a friend that was talking about the same thing as you, and she was saying she supervises somebody and she's going through a lot, and, you know, she understands because we've all been through a lot, but she said it's spilling all over the place, like all over work, like she just, you know, spilled the thing all over the desk. And so she's trying to help her with boundaries, but she hasn't excelled at that level of learned experience where she can set those boundaries. And so, you know what? That's a fantastic idea, Megan. Setting boundaries actually is powerful enough that it should go in there. And I'm happy to put you in the acknowledgments if you would want M. Lincoln in the acknowledgments, because I think that's an important thing. Let me know if you put your email in the chat, and I could get your permission for that, because I think that is really an important idea. So thank you. Okay. Who else would like to share? Thank you, Megan. Did anyone else have any comments?
Yeah. So, hi. I can't find my raised hand anymore at the bottom here. So, I'm glad that there was a pause. I didn't want to interrupt anybody. So one of the things we're constantly having conversations about in the workforce here in New York is, you know, contracts, right? You have older contracts and you have newer contracts, right? And so the older contracts, it seems that, you know, once they're in stone, once they're in place, every time they're renewed, there's no room for discussion on things like, okay, well, we want to start paying our managers more than $25,000 a year because this contract is 15 years old or 10 years old. And that's what, you know, we were paying back then, right? Our managers aren't getting paid that low. I'm just using that as an example. Right. But the bottom line is, how do we also start to have the conversation about things like state versus national funding, right? Because, you know, when you get a grant from SAMHSA, it's a lot different than getting one from our state and city organizations. How do we start having the conversation about fighting for change in older proposals so that we have more money to promote within our agencies? And I'm particularly thinking about the agencies that are medical model who don't create positions for peers to be managers or directors or because they constantly say there's no funding for that. How do we start working with our state, local, and also federal funders to get them to realize that we need to create more room for career growth within the peer industry?
Yeah, that's a deep question, and I think you're absolutely right that we have to. So, you know, what Sean is talking about is this is like a systemic old practice, and at least what I think you're saying, Sean, is in the state and national grants and funding, the money that they allot for peer specialists, even managers and supervisors, it's the same old thing over and over and over again, and it doesn't change. And so how do we actually change that pattern of this is the established pay? And it's always on a hierarchy. It's always on a hierarchy. And I think they're using, you know, to say, oh, well, you know, you're entry level. They just think of us as entry level. So, you know, this is what you get. This is what I'm saying. We as a group have to first envision that we are not on the hierarchy, because I think a lot of peer specialists still see it like psychiatrists, clinicians, social workers, peer specialists. We, in our minds, it's like ingrained, probably because we were in treatment that way, and then we started working that way. And we actually have to change that by getting evidence that we are doing such substantive work to help. I mean, I know for me, my life changed, Sean, because of a peer specialist. It really did. I'm not saying that, you know, my psychiatrist and everything else didn't help me, but I have to make the case that that peer specialist did as much to help me as a psychiatrist, just in a different way. And then say, well, you're paying the psychiatrist $100 or $200, you know, $150 an hour or whatever you're paying the advanced practice nurse. Why is the peer specialist getting 19, 20, 22? Why are we not getting $50, $60 an hour? Do we think we deserve $60 an hour? That's the question. Do we really think it? Because most of us don't have the audacity to actually say, well, I think I deserve $60. We can't even say we deserve 38, some of us, and we really deserve it. So, Sean, I think we need a movement, and that's what I'm hoping this SHARE conference will start, that we start circulating, and I'll get in touch with you. I got your email. When I work on this project, I think now that you said this, I'm gonna circulate some numbers. I think we have to get concrete. I think that's the answer to your question. For 2024, somebody has to say it. Like an experienced, tenured peer support specialist, there's nothing wrong with asking for $40, $50 an hour. What's wrong with that? Because, but why? Not just because I want that and I just want to get paid that, but because this is what I do. This is what the market is. This is the contribution I'm making. So that was an awesome comment, Sean. I will definitely be in touch. Thank you for coming. And we have time for one more comment, if anybody else wants to share. And thank you for the support, Maddie.
Becky, Paula has her hand up.
Okay, I can't see it. Paula, I'm sorry. Paula, would you like to share? You have the floor.
Hi. I'm in Wisconsin. I work at a peer-run respite, and I am the director of that respite. And so I supervise a total of 14 individuals. I have a core team of 7. So I want to kind of touch on what Maddie said regarding that lived experience, because 100% of the people that work at those respite are peers, and they all have their own lived experience, and it does come up in the workplace. And so in looking at this rubric, while I believe that they have to be in a certain place in their recovery, how do we monitor that? at what point do we say, okay, this person's been on a leave of absence at least once a month for more than 5 days for the last 5 years, and that person is still employed with us. And when she's in a good, healthy place, she's doing great. She's an excellent peer specialist. However, when she's not, everything that's ever happened to her comes up, and she becomes more the recipient of peer support than she is providing peer support. Now, I fully believe in mutuality. There is mutuality in respite, but at what point is there a line that gets crossed?
Okay, Paula, great comment. And I want to ask you a follow-up before I respond. There are a couple different schools of thought on this, and I just want to get a sense on what the school of thought is where you work, or where you kind of do your training. There's a school of thought that says, okay, peer specialists, Paula, as a profession at work, okay, when it comes to HR issues, human resources, need to be treated just like anybody else is treated in any other job, as far as HR is considered. There's an HR if there's an HR policy, then they have to be treated according to HR policy. That's one school of thought. Then there's another school of thought that says, okay, peer support specialists, even though we know it's a profession, we want it to be taken seriously, okay, but we also acknowledge that lived experience is a part of the life of a peer support specialist, and living experience is. So what differentiates us is that we have more of an understanding and empathy for the experience. So while we still have to have some standards, we are not going to treat people just like everybody else. What we're going to do is we'll still have standards, but we're going to understand that this person is going through an experience that we all understand. Okay, so which one is it? Is it we're going to treat people just HR is HR, or we understand you're a peer support specialist, you have lived experience, but you still have the standards. Is there it sounds like it's more the second one. They're more letting us slide.
Yeah, it really is more the second one. My staff calls me the queen of second chances and 10th and 100th chances, because I give people lots of opportunities to grow and learn from their experiences. And even when their mistakes are made, my mistakes are a part of life and how we learn in life. And so I want them to be recognizing that growth opportunity, but at the same time, I also have to, when that person is not available, I have to find someone, because we're a 24/7
there you go
program. And so I need to fill that shift. And if I can't fill that shift, I have to close my doors. And I don't want to do that. So
I think you just answered your question, Paula. So your responsibility is to the mission of being of service to people that come to you, but you're also in the mission of being of service to people that come to you as your staff in a way, and also people as clients. So she needs support, that she's trying to seek support as a client, but she really needs staff. You see, there's that mixed thing going on. So I'm hearing what Megan said is boundaries. She needs professional boundaries. That's what she needs. She needs professional boundaries. So the question is, what professional boundaries do we have in peer support? Understanding if we are going to treat people differently, if we are going to have a different model, how much different is it than the HR is HR? So that's an answer I don't have for you, but I think it's a powerful question that I'm going to write down. I think it's a powerful question. So I appreciate you bringing it up, because this is going to be a good discussion question later. Paula, from where are you from?
I'm from Appleton, Wisconsin.
Wisconsin.
Yes.
Okay.
And I would love to be involved in piloting the rubric.
Can you send me your email on the text or on the chat, or do you have a capacity to put, because I got 2 emails to follow up, and I would love to follow up with you, Paula, because you have some good ideas. So
thank you.
This conversation, you all, has been very rich. The peer support specialists in this room, I think, have remarkable experience and really get what's going on the ground. These are the questions of the future. And if you saw in the corner of the title page, it says, are we in a new era of peer support? And does this new era involve taking us to being at the bottom of the poll, to say, you know what? No, we work together to raise the field up. If you notice, in the field of so-called behavioral health and wellness, whatever you want to call it, mental health, substance use, everybody takes from the peer support movement and lived experience survivors. And then the whole field use it. And then everybody benefits and moves on. And we're still like this. So maybe the new era is we take it and say, we're going to lead all of us together. So with that, I want to say thank you all for joining me today. I look forward to connecting with the rest of you in the future. Do not hesitate to contact me. I will respond to you, and enjoy the rest of the conference. Billy, thank you for hosting, and it was good to see you all.
Becky, could you put your email in the chat one more time, please?
Get it? Okay, let me put my email in the chat.
Thank you.
Okay, it's in the chat. Okay, Billy, can you let everybody know what's coming up next?
Yes, absolutely, Becky. So, Becky, I want to thank you and all of the participants for attending and for making today's presentation a success. I put a certificate link in the chat. That's also an evaluation link. We ask that you evaluate the experience you had here today. We would appreciate your feedback. Let me see. The next group is at 10:30, and it's being presented by Dr. Kathy Cash, and the title of the presentation is Navigating Retention Challenges of Peer Specialists. So that'll be occurring in this room from 10:30 to 11:45. Okay? So thank you everyone for attending, and enjoy the rest of the conference.
Thank you, everyone.
Thank you, Becky.
Billy, let me see. I have one
question. I have a question. Do you want us to do the certificate thing at the end of the day, or do we do them as we do each?
The certificate, you should probably request a certificate right away.
Okay.
I'm putting the link in the chat again.
Okay.
What were you going to say, Mark? I'm sorry. I didn't mean to interrupt.
Oh, no. I was just, because I went through it to do for this webinar, and it asked what other ones that I attended throughout the day.
Oh, I see. Well, if you're planning on attending more groups today, then you should probably wait till the end of the day and request them all at the same time.
Okay, that was my question. Okay, so thank you.
If I go to this link now, can I use the same link for the next, if I go watch somebody else's?
Yes.
Or it's the same one?
Yes,
okay.
It's the same link for all the groups.
Okay, then I'll just keep it. Okay. All right, Billy, have a great night. See you, everybody.
Okay. Thank you, Becky.